Hi guys. So here's yet another live session of the Q&A sessions. I hope everyone can see me. Drop me a quick thumbs up if you are live with me on Facebook or Instagram. Just let me know that you guys are live and where you're live from. I love doing these classes because these help me address questions that are the most burning questions that, followers in social media have. So I really, really enjoy doing these sessions live and addressing some really burning questions of how to heal from chronic illness. Sometimes we talk about different treatment methods that I use, supplements, things that are out there. What are the most cutting edge methods and things like that. So really love doing these sessions live. And so we'll get started today. Somebody had asked me to do a session on the HPA axis dysfunction and what that has to do with adrenal fatigue. So they didn't ask me in so many words. What they asked me was that why do I address the vagus nerve specifically when I'm working with patients with adrenal fatigue, chronic fatigue? And so I started going down the whole rabbit hole of HPA axis. So I wanted to talk about it because I think it's so, so important to really talk about the effect that where does adrenal fatigue come from, what the HPA axis dysfunction has to do with that, and then why addressing the vagus nerve is very, very key in healing. So let's get started. And I think you guys have heard me mention this a few times. What is HPA axis? HPA axis is the hypothalamus pituitary axis, and it's in the brain, really. Okay. And so when people say, oh, stress is perceived in the brain, that is actually true. Stress is perceived in the brain. And so because of that, hypothalamus, pituitary, and adrenal axis is really the axis that is responsible for addressing any kind of stress, trauma, any of that stuff. So I want to talk particularly, there's a lot of science behind all of this, but I want to talk about particularly how this impacts people with adrenal fatigue. And so let's backtrack a little bit. For people with adrenal fatigue, they already have some sort of trauma in their lives. They already have, I just got a message. I'm sorry. There's someone said, I am not live on Instagram. So let me see if I can change that. Okay. I think that should work now. Okay, so sorry about that. For the people that are live on Instagram now, looks like something wasn't working, but we are live on Instagram as well now. And so thank you for joining today. I love doing these live sessions. And today we're talking about the HPA axis, how it relates to adrenal fatigue, why addressing the vagus nerve has a key component in treating adrenal fatigue, chronic fatigue, and some of these issues. And then we'll talk about really things that I do to help my patients heal from adrenal fatigue. So I was mentioning earlier on, so the HPA axis is the hypothalamus pituitary axis. And that is the axis in the brain. And so generally, anyone with any kind of chronic illness, adrenal fatigue, chronic fatigue, any of that post-traumatic stress disorder, any of those things, they have a component of trauma already in their life. Now, that could have been the cause of their adrenal fatigue, was prolonged and extended periods of trauma, whether it's going through some really stressful situation in your life, death of a loved one, a war, PTSD type stuff, domestic abuse. I see a lot of patients who have adrenal fatigue post domestic abuse because they live in these high stress situations. So everyone coming to me with a chronic illness and adrenal fatigue and chronic fatigue has some component of trauma already. But once they end up getting sick and they end up getting kind of bedridden or any of those components, there's a lot more trauma that is involved in that. And the reason for that is because, any kind of prolonged illness, if they were very active, very physically fit, or just happy individuals, and all of a sudden they have to go completely bedridden, that in itself is a trauma. If they're unable to do what they used to do, that's a pretty big traumatic situation when you're not the same person you used to be. You can't take care of your family, you can't take care of kids, you can't hold a job. Those are all very traumatic situations that you're adding to the trauma after you have already been diagnosed with adrenal fatigue, chronic fatigue, things like that. Also, people with chronic illness have very decreased social connections because they don't have the energy to go out. They don't want to go socialize with people. They don't feel like it. So that adds to their trauma and their HPA axis dysfunction. They also have increased stress, especially if you have a spouse who is not supportive, doesn't understand your chronic illness. When you look completely normal to your spouse, family members, kids, parents, things like that, they don't understand because they're like, well, you look fine. But what they don't understand is that you're barely able to function. So all these things, different examples of why, once you've been diagnosed with a chronic illness, lead to further causing stress and further causing dysfunction of the HPA axis. So what is the HPA axis? As I mentioned, it's the hypothalamus pituitary axis. And so when there is a stressful situation under normal circumstances, so somebody cuts you off in traffic, or you're driving and a deer kind of crosses the street or something like that, like under normal circumstances, of if you like exercise or if you do a cold plunge, like anything like that, which are normal stress situations, what happens is your body immediately perceives this stress. And so the hypothalamus is the first one to produce CRH, which is cortisol releasing hormone. And so the hypothalamus produces that. That then sends a signal to the pituitary, which tells the pituitary, okay, release ACTH. This is a stressful situation. And so the pituitary then will release ACTH. And then that ACTH is immediately in the bloodstream. It goes to the adrenal cortex and tells the adrenal cortex, produce cortisol. We have just been cut off by a deer. We have just, someone's cut off in traffic. We have to immediately brake, something like that. So it tells us, like, produce cortisol, quote unquote, run from the tiger. And that cortisol, that what jump starts your muscles and things to get you out of that situation. Under normal circumstances, this cycle kind of goes down very quickly, because then the brain realizes, the hypothalamus realizes, okay, the deer's gone, we didn't hit it, or, oh, we just got cut off, we just had to really brake hard, or, oh, we were only exercising for 40 minutes, blah, blah, blah. So the hypothalamus quickly realizes that, okay, the stressful situation is gone. We've taken care of running away from the tiger. So let's stop producing the CRH. And then that in turn tells the pituitary, let's stop producing the ACTH. And then that in turn tells the adrenal cortex, okay, we're safe. You can stop producing cortisol. So that's a normal cycle that happens in a normal individual. However, when it is a patient who has adrenal fatigue, prolonged trauma, again, like I gave you the examples, domestic abuse, death of a loved one, job issues where, very high stressful situation of a job, things like that. When you're in this prolonged cycle, then your hypothalamus continues to produce CRH because it sees the situation as a constant stressful situation. And so it continues producing CRH. That in turn continues telling the pituitary to produce ACTH. And then that in turn continues to tell the adrenals to produce cortisol. And so what it's doing is this vicious cycle, because nobody's settling down. Nobody's saying that we are safe. And so this vicious cycle goes on and on. And so that's when the adrenals start producing too much cortisol. And it's a very, very high level of cortisol that keeps happening and getting produced in the body. So these are the initial stages when people, if they're in stage 1 or 2 adrenal fatigue, they'll come and they'll say, oh, like, I'm really not sleeping well, because they have so much cortisol. So your body is keeping you awake to run from that tiger, to brake really hard. Your body is keeping you in that fight or flight. So it's keeping you awake. So the cortisol in your blood system is very, very high. And so you cannot sleep because of that. And then also, you have frequency of urination constantly because it's trying to get rid of all that cortisol out of your system. Irritability, anxiety. I have the patients who come to me in these early stages, like severe anxiety, because their cortisol is constantly high in this vicious cycle. But they even start having joint aches and pains because increased cortisol for a prolonged period of time is very, very inflammatory. And so they continue to have this pain in joints and muscles, and they just really feel lousy. So these are the initial stages where constantly the hypothalamus is stimulating the pituitary is stimulating the adrenal cortex. And for the first few months, even a year, maybe a year and a half, constantly producing the cortisol from the adrenals. At a certain point, the adrenals say, you know what? We've done this long enough. We are exhausted and we cannot produce any more cortisol. So we are done. And so then that becomes a negative feedback loop where even though there's firing from the hypothalamus pituitary, the adrenals are exhausted. So that's really technically the term is adrenal fatigue, is because then at that point, the adrenals are like, we cannot produce any more cortisol. If we produce any more cortisol, it's going to be very damaging to the body. And so then the adrenals start shutting down. And so that's where, the term adrenal fatigue comes in, or chronic fatigue, or whatever. And the problem with when you have prolonged cortisol for a long period of time, whether it's, a year of a stressful job or any of the above conditions that I had talked about, then you get to stage 3 and 4 of adrenal fatigue, where the adrenals are like, done, not producing any more cortisol. You need to be bedridden. You cannot be doing anything else. And so that's when you become bedridden. Your body doesn't produce any cortisol at all, which, as you know, when you wake up in the morning, your cortisol is the highest because it spikes up and then slowly comes down to get your muscles moving, your organs working, your lung, your liver, your GI system, everything kicks in. But when you've reached a point of stage 3 and 4 adrenal fatigue, where your body doesn't produce any more cortisol, all of those things are affected. You can barely get out of bed because your muscles are not getting this constant message like, okay, hello, time to get up. You cannot exercise at all because the body just cannot produce any more cortisol. And if you do try to exercise, it causes a serious crash. You cannot handle stress at all because at that point, your body is like, I'm done. I cannot produce any more cortisol for you. And this negative feedback loop is just not working. That amount of cortisol, when you've had high amount of cortisol being produced for a year and a half, it starts damaging the frontal lobe of the brain. And so that's what causes a lot of memory issues. It causes a lot of inability to do small basic math problems, things like that. It really starts affecting your cognitive, and you start having cognitive decline, depression, you cannot exercise. So that's when you really are termed as, stage 3 or stage 4 adrenal fatigue, because your body says, we are done. We cannot do this. So in my practice, when patients come to me with significant, even if it's stage 1 or 2 adrenal fatigue or stage 3 or 4, the first thing I do is to address the vagus nerve. And why is that? Because once I address the vagus nerve is the one that is responsible for the autonomic nervous system, for the rest and digest. So not the fight or flight, it deals with the rest and the digest. So first, I got to take your brain out of this danger zone that you're in and take it out of there. And whether it's, if I were to say, okay, leave that job or leave that spouse or whatever, or leave that situation, still at that point, you've already had this negative feedback loop. And we really need to start stimulating the vagus nerve so that it starts putting your body in more of a rest and digest, relaxed state, that it can then tolerate a lot of these things. So anybody who comes to me in my practice, especially because my practice deals mainly with patients with chronic illnesses, adrenal fatigue, chronic fatigue, all of that stuff, the number one thing I do is I help them with their vagus nerve. And the way I do that is I use phototherapy patches that I patch behind each ear, because that's where the vagus nerve runs. It's one of the largest nerves, and it runs from the brain all the way down. So I patch the vagus nerve to start stimulating the vagus nerve. And I'm telling you, I get immediate results with these patients within 2 to 3 weeks of patching the vagus nerve. I think you guys may have seen this on my page, but I have a testimonial with my patient Annie, and she was a patient that was seriously bedridden for a long time, like 6-7 years. And the only thing I did with her when she started working with me was address her vagus nerve. Initially, she had a tough time using the patches because she had so many sensitivities. But over time, as we increased, her tolerance to the patches, she started doing phenomenal. And Annie's not my only patient. I know I refer to her a lot because I have, the testimonial, but ever since I started working with patients with adrenal fatigue, the number one thing that I do is to address their vagus nerve. And, this stemmed from my own story years and years ago, where I was diagnosed with stage 3 adrenal fatigue, 3B actually. So I was pretty much bedridden and couldn't do anything, couldn't even go up a flight of stairs, or couldn't take care of the kids. And so it took me almost 2.5 years of all true and tried different methods that I used from my toolbox that I ultimately dug deep into the literature to see, like, yes, I have adrenal fatigue, but where is that coming from? And so since then, it's been years that I have been using this technique to really, really help treat my patients with adrenal fatigue. It's to just address the HPA axis and the vagus nerve. The moment we can break that loop and we can kind of get it out of that negative feedback cycle, and you stimulate the vagus nerve to start doing what it needs to do, which is calm your body down, take it out of this cell danger response, immediately patients start seeing an effect. I have a patient right now that I've been working with for about almost 2 months, and she's just done so well with just doing the vagus nerve protocol with her. So really the key is to just start bringing that cortisol down, to tell your body that it's out of fight or flight situation. It needs to be in rest and digest. There is no tiger chasing it. It's not a permanent situation. And so then once you start addressing the vagus nerve, then all of those things start falling into place. So with my clientele that come in that with a chronic illness, like I said, adrenal fatigue, chronic fatigue, the number one thing I do is to start addressing their vagus nerve, and they immediately start getting a lot of benefits. So if you have any questions, feel free to comment them here or reach out to me, and I'll be happy to do a free call with you to see how we can address vagus nerve and HPA axis dysfunction to get you to the root cause and start your healing journey. Thanks.